Hi, yes, I'm in my pajamas and I'm also talking a little low, so please do turn up your speakers if it's too low. It is about 6 o'clock in the morning and I have a meeting to go to this morning, but I figured I'd make a quick video about test anxiety because I've gotten a couple of emails through YouTube regarding test anxiety and the NCLEX. I didn't realize that I had test anxiety until I was actually in nursing school. I think I was taking a pharmacology class, and I had the best pharmacology teacher. She was awesome. She was also the same teacher for the class I took, mental health, but she was my mental health clinical instructor, and she was really amazing. She was a really cool person. But I didn't realize I had test anxiety until I started failing some tests in pharmacology, and I would get pissed because I'd be like, I don't understand why I failed. I knew the material. So I went in her office, and she would, go over the test with me, and she would clearly see, yes, you do know, but for some reason you chose something else. And then one day after a test, she pulled me in the office, and she goes, I want you to see something here. And I said, okay, is it bad? And she says, no, but I think this is the reason why you're having problems. And she, we had Scantrons, and I don't know if you know what those are, where you just kind of bubble like A, B, C, D for answers, and then they just stick it in a machine and it auto grades it. She said that I had been skipping answers on the Scantron, which I thought was really strange because I didn't know I was doing that. Normally, if I skip a question, what I do is I put a little dot. That means I've got to go back to it, and I didn't do that. So there were no dots on anything. So she said that I had test anxiety. Well, I already had been diagnosed with ADD/ADHD several years prior to nursing school, and it wasn't until that point I realized that I'm going to have to separate myself from other people in the classroom. I was getting very distracted with the sounds in the room. We had one girl, I don't know if she was in my pharmacology class, I think she was. She had COPD or emphysema or some sort of asthma. I think it was more COPD. And she was always coughing and stuff in the room, and I would be like trained on this thought, and I'd have a lot of problems, concentrating, and it really wasn't her fault, but at the same time, they probably should have taken her out and put her into a room away from everybody because it was very distracting. And guess what? She was also in my NCLEX. When I went to, instead of telling you more about my nursing school experiences, actually when it came to the NCLEX, I did not ask for special services from the state because I wanted to take the NCLEX as soon as possible and after graduation, and in order for me to get special services from the state, which I actually had, I was able to, if I could provide a note from my doctor, which I had all that stuff. I had documentation of the diagnosis from a psychologist and a psychiatrist, and then I had stuff from the disability office from the school I went to, but when I got the form to go to the take the test, I got kind of disturbed by it because I was like, I really do need a quiet room and this whole 9 yards, but I would have to wait longer because I'd have to submit this to the state and then they'd have to review it, and I'm like, you know what, just I'll deal with it. So the girl that was coughing, unreal, it was meant for me to just deal with it, was there on my NCLEX. So I was very scared. I made sure I had a good night's sleep before, as best you can. And somebody told me to have a Snickers bar beforehand, but I don't suggest that because you don't want a whole lot of carbohydrates on board while you're trying to take a test, and then you go up like this and then you drop. What I do suggest is eating some food that has some protein in it in the morning, and just have a a complex meal or a balanced meal in the morning. Don't go in hungry. Make sure you stay hydrated. Do your breathing techniques. I actually did start to have a little bit of a panic attack when I sat down. I asked for headphones. You are allowed to request those. And when I did, I could start hearing my heartbeat. So it was then I realized that my hands were all sweaty and everything. I needed to just take it easy. So, and something else to realize is the NCLEX questions really aren't that straightforward. Some people say they were, but I'm not the best test taker, and I'll have to say that I tend to look at the distractions versus what they're really asking. So you have to realize a lot of things that they throw into those questions, they're a little bit more straightforward than they were when they were in nursing school. However, they still throw the distractors in there. The distractors seem to be more on the answers than the question itself. So, and another thing, so you just kind of need to focus on how to answer those questions, or yeah, and also find out how do you feel. I mean, kind of get in touch with yourself before going in. Why is the NCLEX making me feel so, nauseated, and why do I get so nervous? And work on that before you go in. If you need to do deep breathing exercises, which I actually did while I was sitting in front of the computer, deep breathe in through the nose and out through the mouth, and I sit there and close my eyes, and I was literally, I had my hands like this, and I was like, and I don't care, because you're in this cubicle. You know what? I don't care what anybody else around me thinks. I'm going to pass the NCLEX, and if it means I look like a total idiot in front of everybody, I do. I don't care. Bring bottled water with you. Now, they don't let you bring it in there, but they let you keep it on the outside. And then just, take a break when you feel like you're overwhelmed. I don't know how many you're allowed to have, but you don't have to wait until the computer tells you to take a break. In fact, once I kind of got into the groove of things, I just kept going past the break. And it wasn't until it started to get up to like question 100 I started to panic a little bit, because I was like, actually, it was more like question 150 or something, because I had already been asked if I wanted my break, and I was like, no. So I was getting a little concerned, because I'm like, okay, they're really asking me a lot of questions. So I started to panic a little bit, and I said, that's it. I got frustrated, so I raised my hand or whatever, and they let me go take a break, and I got some water, and I went in the bathroom, and I just relaxed, and I did my thing in there. I don't know if I peed or what I did, and then I just took my time washing my hands. There was another girl in there, and we were talking, and I just had a reality moment. I looked in the mirror and told myself, I can do this. I'm not going to give up, and I'm not going to let this beat me. So I went back in there again, and the computer started asking me the same questions over and over, and it seemed to be asking me a lot of questions about insulin and hyperglycemia, hypoglycemia, and the side effects, and this and that, and different types of insulins and stuff. And I realized that I must have been answering those questions wrong, because it was drilling me on those now. The NCLEX is designed to question you over and over and over to test your weakness. It will find your weakness, and it will question you over and over and over, and if you keep answering those questions wrong, then you're going to fail it. I'm able to see patterns and things. I don't know if it's just something that I'm just good at. My mom always said I was really good with puzzles and shapes and sizes and things like that when I had my IQ test when I was a kid and stuff. But just kind of look for the pattern in things too if you're really having a hard time taking the test. And if anything, study every day. Every test is different. Some people have different questions. I didn't have a whole lot of what everybody else was saying, but yet, I had like, what's the norm lab, for this, or, and I had a lot of priority questions. But I was going to tell you, that's really the best I can tell you to do. Everybody's different, and, do what works for you as far as calming down. Some people, like one of my nursing buddies before I became a nurse, told me to eat a candy bar before going in. I don't really suggest that, because you don't know how long you're going to be in there, and they don't sustain your hunger for very long. Protein does. Eat something that you're normally used to eating, and something that won't upset your stomach, because everyone's going to get knots in their stomach, and you don't want to go in there feeling sick. So that's the best advice I can give you. If you still have any questions, feel free to let me know.